So our esteemed panel today is Dr. Stanya, who is our chair of pediatrics and who is awesome. There's your feedback. Has been here at UAB for several years, was a residency director. I wasn't going to say the actual number, but was a residency director and has been chair of pediatrics for how many years? 24 years. So very, very lucky. He's a great resident and faculty advocate. We're very happy to have him. We also have Dr. Michelle Nichols, who is, as you all know, one of our pediatric residency directors. Has been doing that for several years. And Dr. Nat Robin, who is our director of genetics and also in charge of the genetics residency. All three of these individuals, if you look through their CVs, have numerous teaching awards. These are the best of the best right here. So we're very excited to hear them tell us how to get promoted.
All right, for the next 30, 45 minutes, we're going to talk about the promotion process, all right? And I want you to kind of pair up with somebody that you can talk to real quickly. So, because I'm going to propose some questions and y'all can look at each other and say myth or fact, all right? So we're going to try and dispel some myths and maybe get everybody on the same page. All right? So everybody have sort of a partner or somebody they can like eye and go, okay, myth or fact. All right? Okay, first one is, promotion information is a secret and not accessible to all faculty. What do y'all think?
Fact.
All right. That's a myth. All right. And the truth is, there's lots of information posted on the UAB website and the UAB medicine site. And so you're like, okay, so how do I get to that? And so if you just go to the internet, so you can just type in UAB Department of Pediatrics. Let's see what comes up. All right. And then you can just go under UAB Department of Pediatrics. You can go under here, and it says Development. All right. And then here, Faculty Development. And Appointments, Promotion, and Tenure. You can go there. And then it tells you about different things. It tells you mentoring. There are people in here that are mentors. There's a pediatric mentor list. Actually, you might not even know that was there. There's a list of people if you're in basic research or teaching or clinical. How many of y'all knew that was even there? No one. All right. You can go back here and faculty development activities, what's going on. This will tell you how to get promoted. There's grant opportunities. So there are things on there. And then,
Michelle?
yes.
I'm sorry to interrupt, but if you go back to the faculty development
Yes.
and scroll down, there's even more information that's really important that tells you all the top secrets. The very bottom, the
Oh, right. Yes. All of these things. So when you go here, some of the things that I'll talk about are all on here. All right. But you can also go to UAB School of Medicine Promotions. All right. UAB Faculty Promotions and Tenure. And they've got helpful hints. You can go down here, and again, some of the things that Claire talked about are right here. All right, your formal CV, templates, promotion packet, binders. Did y'all know that was all there? So that's where you can actually go. So now y'all know, and don't tell anyone else because they didn't come to the workshop today. All right, so there are websites out there that will help you. All right, and so just like we said, if you just go to the UAB Department of Pediatrics, go to faculty and staff, go to development, and then all these things are on the right in lots of forms, and we can talk about that too. All right, what do y'all think? Make your CV memorable. All right. Did y'all tell your little partner, fact or myth? All right. Okay, so this is how I made my CV. I wanted to make my CV memorable, and so here's my CV. So, I mean, it's cute, and we got lots of little smiley faces and little cute signals and all that kind of stuff. And so I don't think Claire would actually turn that in. So really, that's a myth. And I think what you want with your CV is you want it to speak for itself. You want it to represent you, right? You want it to be professional. You want it to look like you actually cared. But there is a standard UAB CV form, and I think you have that actually in your handout, all right? Your folders. So it's a 2-page thing. I made it a 3-page, but this is how you have to have it, what form. And so you may as well go ahead and take whatever you had in medical school or in residency or for fellowship or now faculty and put it in this form because it is the form that you have to have. And they're pretty strict about it. And it will be reviewed and it will be changed if it's not. And so it's easy to go ahead and put it into that form. And you do want your CV to be impressive, and so you've got to figure out what's going to be in your content. You don't really want to pad it. You don't want to make everything redundant. You don't want to list in 3 different places that you were a mentor to Will Sasser. Clinically, I was a mentor to Will Sasser, and then I actually did research. I was his research mentor with Will Sasser. And then, actually, I was his teaching mentor as well, Will Sasser. So you want to be sort of concise. You don't want to be redundant. You also want to be sure and put your dates. You don't want to just put that you're a PALS instructor. Well, when were you a PALS instructor? Are you still a PALS instructor? And one of the specific things I think that you want to be sure and put on there is grant information. You want to put complete grant information. Are you the PI? Are you the co-PI? Are you just enrolling patients? How much money is it for? How long does it last? So you want to put everything on there. And you want to cite your references just like you would in a journal. A lot of times we get it and they'll put the name of the journal and then they'll put, maybe the pages and then they'll put who the authors were. You want to be sure it's actually how you would be referencing it in your publication. You want to highlight your name. And all of this is in the instructions as you read through it. I think when I have to turn in my CV, I usually borrow Kathy's because we do a lot of things together to make sure I remembered everything that we have done together, and we'll talk about that a little bit too, but also ask other colleagues to review your CV kind of thing. And this is also, I think, one time where, like Coach House said, point back, because a lot of times I remember, oh my goodness, yeah, Kathy helped me do that, or Laura, yeah, helped me do that, and I think remembering how I got where I got is a good thing. Remember, it sure wasn't just me by any means. There was a lot of people that help you get where you are, and it's kind of like the flying geese, how you're going to, you help each other out, and you're going to help promote each other, all right? Also, I would say be precise. A lot of times people put I was on the recruiting committee, and I do know who is on the recruiting committee, and they probably hadn't recruited anybody for 10 years. And so I'm like, oh, are you really on the recruiting committee? Or it'll say Outstanding Teaching Award in Pulmonary for 2012. And what they really got was a letter of commendation in pulmonary for their faculty position. So I think, be precise about what you get. So my CV then ended up pretty boring, looking like this, without all the little glitz. And I think sometimes you get confused about what you're supposed to turn in, but remember your faculty activity form? Who all in here has filled out one of these? Do y'all love filling them out for Dr. Stanyo? No. Well, it's every other year, and the chairman meets with you every other year, but it's kind of your checkup. Like, where am I? Where am I focusing things? Where am I? And so this is for you. This really isn't for him or for the division. It's really for you to set your goals and say, okay, here's my checkup. Oh, my goodness, I'm like turning pages and I haven't done a whole lot, but, here's some ideas of things that I could be doing, all right? Your division director should be meeting with you each year as well to kind of keep you on track, all right? Now, this may depend on myth or fact how old you are, but memory is good enough. Kathy's like, I think yes. Dr. Pagan, your memory's good enough. All right. Well, I don't know about y'all, but sometimes I give lectures or I forget to write them down. I can't even remember what month they were in. So I think one of the big things is write everything down as you're doing it. Have a CV on your desk, in your bag, whatever, that you just jot things down as you do it. You fill it in. And so then when you actually have to formally give it to someone, you already have, when was that lecture that I gave? When was that accolade that I got or whatever? When was the presentation? Was that in New Orleans at SSPR this year, last year? So write it all down so that you kind of have it right there. And your promotion portfolio, I think Claire would attest to this when people hear, I got a promotion coming up. Oh my goodness, I got to update my CV. I haven't updated it in 5 years. So be sure and keep it up to date. It should be something that you build over years and not like that week when you find out, oh my goodness, I'm up for promotion. I've got to do something about this. All right? All right, what about this? Myth or fact? Once on a track, always on a track. Anybody know what I mean by that? Okay. All right, so there's tenure and non-tenure track. Which one's better? Neither, right. It's for whatever you are and whoever you are and what you want to do, right? And so that's a myth. And it is that you can change tracks. You can change tracks once, all right? So if you're a non-tenure, you want to go to tenure, you can do that. If you're a tenure, you want to go to non-tenure. And sometimes you would want to seek out advice. Where do you want to start or where do you want to end up? And when we actually do promotion, we do it separately, all right? We do promotion and then we do tenure. And you actually have 10 years to earn tenure if you're on a tenure track. Now, it's people take it kind of as a negative if you're on a tenure track, and we go, really, actually, we could promote you better. You'd have, we think you're going to really excel if you're on a non-tenure. Or the opposite, somebody on a non-tenure track, which I think, Marjorie, did you start on a non-tenure? I can't remember. And so we're like, oh my goodness, look at all this she's doing. Look at all this research. She would really excel on a tenure track. So I think some of it is seeking out advice and finding out. But one is not better than the other. It's just where you are and what you want, So we want to dispel some of those myths. You can't be tenured unless you are at least an associate. All right? What about this one? This will be different answers for different people probably sitting in this room. Publish or perish? Myth, fact? So it depends. If you're on the tenure track and one of your 2 areas of excellence is, so we have 3 areas of excellence. There's research, there's teaching, there's service, okay? If you're on a tenure track, you must excel in 2 of 3, all right? And if you're on the tenure track and you have 80% protected time for research, guess what? You're expected to produce. If you have 80% protected research, and in 6 years, when you're coming up for promotion, you've published one thing and you have no grant support, people are going to be going, okay, for 80% of your time, what have you been doing? However, if your 2 areas of excellence are teaching and service, then you probably aren't going to have that many publications because that's not your area of excellence. If you're on a non-tenure track, you said no to the tenure, you're on a non-tenure track, excellence must be demonstrated in 1 of 3 areas. And so when you submit your promotion packet, you're going to highlight your area of excellence or your areas of excellence, okay? And actually, when you look at all these little, when you look at all the papers that we showed you where you can access things, it's all there. So faculty appointment, assistant, associate, professor, what's expected, all right? And then there's another handout it actually tells you the timeline. If you're up for promotion, what happens in March, April, May, June, July? What is the actual timetable? And I think Nat might address that a little bit. And then there are actually suggestions or pitfalls. This actually tells you what are your sections going to be, and you tab them now. Did you read? Okay. And then there's a portfolio of teaching and evaluation for teaching. But what I liked about this handout is portfolio in teaching, research, and service. It says, okay, for teaching, excellence. What do you say is excellent? And so it says specific expectations to achieve excellence in teaching, and it lists several things that would meet that qualification. But then it says activities that are valued but would not in and of itself meet the qualifications for excellence. So like specific expectations for excellence would be like if you're a course master and you can prove that you're effective. You have developed a new curriculum and you can prove that it's effective. But things that are valued but maybe not enough to say, oh, this is where my excellence is. If you're on a curriculum committee, if you're on a recruiting committee, those are all good things. Those all contribute towards your teaching excellence. But in and of itself, you're probably not going to achieve excellence just by being on a committee or recruiting people. So it's really good. It outlines in teaching. It outlines in research. What do you have to do to achieve that level of excellence? All right? So that's another good handout that's there as well. Also on there is it tells you about being evaluated. Summary for evaluating teaching, for evaluating scholarly activities, for evaluating clinical activities. So these are great handouts if you want to read through them. And there's actually, on the UAB one, Nat's is actually here, his little portfolio. Because what you usually do is you write a little intro. So here's his clinical service portfolio. He writes a little intro, and then he puts all the supporting evidence behind it, all right? If your area is research, you write a little intro and say, this is what I'm doing, this is where I emphasize, and then you have your supporting data, okay? What about this one? Find your niche and make yourself unique. Is that a good thing to do? Myth? Doesn't matter if you're unique or not. It's a really good thing to do if you can do it, and it's not as easy as it sounds, and not everybody can be the sole leader, but I think about Lane Rutledge. There's only one Lane Rutledge in the whole state, right? She's made herself very unique, and we will do anything to keep her, right? Because she's so unique, and we need her, right? So developing your own niche, and what is that? Finding some area that you value, that you think is important, okay? That maybe you're going to be the expert in, all right? Things like ADHD, things like autism, things like maybe you're the abuse expert, all right? Find something that is really going to make you unique, something that people are going to value. So you think about things you're really good at, all right? And then you think about things you like to do, and then you think about things where you could really excel, where you could really make a difference. All right, this one, what do y'all think about this one? Myth or fact? Be best buddies with Dr. Stagno. Dr. Stagno said when promotion time comes around, some people are like really nice to him. They're like, yes, Dr. Stagno, what are you doing? Yeah. Did you hear about my whatever, R01? Did you, so. But the interesting thing is, actually, Dr. Stagno is on our promotions committee. There he is. But he actually doesn't get to vote, all right? He has no vote, all right? He's just a lame duck sitting there, all right? And however, we do all know that Dr. Stagno is the one that makes our initial appointment, and he's the one that helps us declare our pathway. He helps us with our faculty reviews and makes sure that we're on target. And I think your division director plays a really key role because they're going to determine your faculty, your readiness for promotion. Okay, they're going to be the ones that are really going to be more day to day, all right? So be in contact with your division director. Tell them what you're doing. Tell them what your goals are, all right? Dr. Stagno is the overseer, but on the promotions committee, he doesn't push through anybody. He pretty much sits there and listens. We do read a lot of the reviews of the chairman, of the division director, and of the promotions committee. All right? This one's pretty cool because I like to kind of think it's a secret society. Do y'all know where you can even find the names of who these people are? Like, do y'all know? Who can name people that are on the Pediatric Promotions Committee? Who's on it? Okay, good. That's 3. Okay, all right. All right. Dr. Nichols, all right. What about the UAB Faculty Council? Who's on it? All right. Any other pediatric people? Do we have any representation? All right. Not that you really need to send these people cookies or brownies, but they, So on our committee, we have 9 tenured and 3 non-tenured, and we like to get a mix of cross-sectional subspecialties and people that are well-versed in different areas. So we have 12 committee members, and there they are. And Dr. Whitley is our chair, all right? And then on the UAB faculty, our representatives are actually Ray Watts and Erica Liebelt, all right? So those people actually also would be good resource people to say, hey, this is what I'm thinking, this is what I'm doing, or here's my package, or what could I improve upon? All right. What about this? We may feel like this is truth, but you're on your own, all right? You're on your own. And I think we really don't want to be that way. We want to be like Coach Haas said. We want to be the geese. We want to be the people that help each other. We want to be the people that make it smoother, make us faster, make us more efficient. And so I think one of the big things, and I think I recently got a survey about this, but mentoring relationships. How many people are in an official, formal mentoring relationship here? All right. A couple. Are you in mentoring relationships with residents or with fellows or with faculty members? Formal. We're on formal. Both? You have a formal faculty mentor? Yes. Anybody else in here have a formal faculty mentor? Very good, Dr. Peg. Anybody else? All right. What? JP? That's right. You ran him off. All right. But I think, how many in here are in informal mentoring relationships? I think every one of us in here, right? Whether you are the mentor or the mentee, right? And it might not be even an age thing. Like, there's definitely people that are younger than me that I'm like, oh, I want to be like them, right? So I think I would just encourage you to, find your fellow geese and be able to work together. Use the resources that we're showing you today. Go on there, print out. I have to print them out. Y'all are probably being able to look at things, but I have to have them in my hand and I have to highlight and go through them and see, I don't want to be by myself. What is a mentor anyway? Some of y'all said y'all are in mentoring relationships. What is a mentor?
Someone who guides, offers expertise.
Okay, good. Expertise, guidance, encouragement, right? You want to have somebody as a mentor that somebody's committed to excellence, right? And you might be that person or you might seek out that person. And I think, was it Marjorie Lee, were you the one that sent me the survey about mentoring? And I had to kind of step back and I'm like, I don't even know if I'm in any formal mentoring relationships aside just with the residents, but I don't actually have my own. JR won't let me have my own residents anymore that I'm their mentor for. So I feel like I have a lot of mentoring, but like I want to be that person. I want to be able to be the person that guides and advises and encourages. And so along those lines, make new friends. I love that song, make new friends. And so I think networking is really important. And what is networking? We always hear about, it's a good time to network. And I think you ask, are we going to be able to talk to each other? And then to me, that would be part of networking. What is networking? Good. Yeah, excellent. So it's kind of building relationships, informal or formal, right? And being able to seek out, and a lot of times you meet somebody and you're like, oh, you're interested in that too? Oh, that would be great. Maybe we could do something together. And I think, I know that I feel like our division is getting better at that, but we're in the dungeon by ourselves, and so we kind of feel like we're a little community unto ourselves. But it's so cool when we start working with, the asthma pathway. That's great. We can work with you on that. Or, working with critical care, and let's see these patients that come from here and go to there. I think just building bridges is part of the thing. And you want to do that locally, you want to do that regionally, you want to do that nationally. You want to do that in areas outside of our community, because when you're promoted, you have to have 6 letters, 3 inside and 3 outside. And the outside can't just be, because they work in a separate building. Outside needs to be outside of UAB. You need to establish some kind of presence. It doesn't mean you have to be the president of another society, but take advantage of networking with people that are outside of UAB, outside of Birmingham, Alabama. All right? And in order to be promoted to professor, you're supposed to have some kind of national recognition. And that may take many forms, and that would take a long time. Yes?
I'm sorry, I just wanted to
Yeah.
mention that a lot of people, when they're going to associate professor, have just developed a relationship with their school where they train. So if you are training in the same Cincinnati and you come to UAB, it seems like there are a number of times when you have only letters from Cincinnati come in to support that person. It's always good if you can expand your horizons from there. That's not necessarily gonna ding you, but it's not in that.
No, it will ding you. So if you're coming from Cincinnati and your letters are all from the people you trained under, we at the faculty council level will immediately question, do you really have your own reputation? It's especially true for researchers. And we will go so far as to look at your CV and see you published with Dr. Jones, and look, there's a letter from Dr. Jones, but you came from Cincinnati and Dr. Jones is in Utah, but Dr. Jones went from Cincinnati to Utah. So we actually look at that kind of stuff. So you really, even from assistant to associate, you need to establish an independent person. It doesn't mean you're working on something different than you're working on as a fellow, but the letters be tied back to your training. And it's especially true that your papers still have your mentor on them. It doesn't mean it's a kiss of death. It means it has to be explained.
And you certainly could have one of those, but you want all of them to be. Because you do want people that know you well as you know, also. All right? And some people think the bigger the promotion package, the better, right? So they will include all sorts of things. And it's always good to have a lot and have to wean it down rather than to only start with this and have to build it up, because you're trying to go, okay, what else can we put in here? But you want your promotion package to be concise and direct, and you want your introductions to your areas of excellence to be very on target, and you want to be able to highlight the important things. You don't really want to include emails from parents or students, or you don't really want to include all your PowerPoint lectures, you know, slides 1 through 90. You might have the first slide and then have your evaluation behind it. You might have something that's highlighted that's really like an award or something like that, where you want to highlight it and you have your letter of congratulations. You might want to do something like that. But we don't really want to pad it. We don't really want to have extraneous stuff. And so when you send it actually to the Department of Pediatrics, and I think Dr. Whitley and the committee does a great job of saying, okay, this stuff needs to go and this stuff needs to stay. And so people will help you with that. You do want to include your awards, you know, your list of mentees, and faculty council is going to review about 85 of these per session. That's the number that I got, some closer to 100 per session. So they're not going to want to weed through yours. It's this big. If you can condense it and have all the important stuff, kind of like Pete's study, every sentence is important. Like, have it where you present it and they know, oh, okay, this is important and this is important. Oh, wow. You want to be able for them to be wowed by everything that you have on there. And then lastly, you are in charge of your own destiny. I think really that's a fact. And so I think, like Coach Haas said, you know, go ahead and think about your dreams, and maybe you're not going to play in the NBA, but maybe you are going to achieve other things by setting your expectations high or your goals high. And decide your priorities and your goals and what kind of pathway you're going to have. You know, what people do you need? What support do you need? What funding? What time? What's your timeline? And I think your career path is going to be unique. You're going to have your own footprints, your own handprints all over it, and hopefully other people's too that have helped you along the way.
Okay, so I'm the chair of the faculty council. I've been on the faculty council for about 7 years now. I was a member for a couple of years, and then J.P. Clancy, who some of you may remember, he and I were elevated to the role of assistant chairs or associate chairs because the work was getting quite a bit. And then the chair left, and J.P. took over his chair, and then J.P. left, and I wasn't quick enough, so I was named chair. And then a couple of years ago, we decided, because the committee is a pretty large committee, and it does not only the School of Medicine but the Joint Health Sciences. So we do a lot of, you know, half of what we do are people whose primary role is as a funded investigator. Lori McMahon, who's in neuroscience, a professor of neuroscience, she and I now are co-chairs, and I think it's a pretty good arrangement. As Michelle mentioned, we're about to hit our we just hit our busy season where we'll be reviewing about 100 packets real quickly. So I'm going to go through some slides. I give this talk about 5 times a year in one form or another, but I'll do this real quickly because a lot of it Michelle has covered. So there's promotion and there's tenure. Promotion, advancement to a higher level of academic rank. Tenure, we could talk about what tenure is, what tenure means. Honestly, the only thing I have figured out that the tenure allows you to do that not being a non-tenured faculty you can't do is be on faculty council. So that's a dubious distinction. But the way we view tenure extremely seriously at faculty council because we feel like we are betting the university's money on somebody's future success. And we have made a very strong effort in talking to the dean, and we're right now in the midst of actually some transitions. So the way things are done, were done last year, the way things are going to be done this year, and the way things will be done in the future probably won't be the same. But one of the things we're doing is we're trying to divorce the awarding of tenure with promotion and make that the exception, not the rule. The common thing has always been if you're in the tenure track, you go up for promotion and tenure from assistant to associate, and we're trying to do away with that. for the simple reason, I'll mention it a little bit, but we're trying to do away with that. Okay, ranks, discussed already. The big difference between tenure earning and non-tenure earning, and the tenure, and that's a decision made at the time you're hiring. And sometimes if you are somebody who wants to switch track, that might mean you have to get fired and rehired. It depends at the university level how these jobs are crafted. The majority of people in pediatrics in the non-tenure earning track, and I forgot to mention, and I want to mention at the outset, that of all the departments we deal with, I forgot how many departments there are. Some I could sit here and I obviously won't, but I could tell you what pains in the what they are, because their packets are never very good. Pediatrics is the opposite end. The pediatric packets are always among the best prepared, the easiest to deal with. And while what Michelle said is true, that you guys are responsible for your own work, it's kind of like, the analogy I'd use is like the process of making a really good meal. You guys are the farmers or the cattlemen or whatever, and you give Dr. Stanio and his office the raw material, and they really craft the message that we receive. And your department, and I'm not saying this because he's right here, but your department is as good as any, and Dr. Whitley is another person who really gets a real commendation there. I can't remember, actually I can remember, but it's the exception that we have any issues with any of your faculty members. So the criteria Michelle mentioned are based on three major things. There's research, teaching, and education. But scholarship is the underlying principle. And scholarship is expected of all faculty members. If you're 100% clinical, just seeing patients in your clinic, scholarship is, and in the non-tenure track, scholarship is still expected. How we define scholarship, though, is very liberal. And but it's important for you to know that, because that needs to come out somewhere in your packet. The criteria were revised about 8 years ago. My chairman, Bruce Korf, was the head of that committee, and they used Boyer's definition of scholarship. And you can read it up here, but scholarship is generalizable knowledge, and it goes beyond just what you're doing. So there's scholarship of discovery, which is research, scholarship of teaching, scholarship of application, which can be considered research or teaching. Or service, and scholarship of integration, which really doesn't fit into any of those. But for example, when I was going up for promotion when I was at Case Western, the idea of writing a review paper was a nice thing, but it really got you nothing. Under this definition, writing a review paper really counts quite a bit, because you're going and taking a lot of knowledge and making it accessible for another audience, and that definitely counts. So understanding how your activities count in the metrics of faculty council, in the metrics of the promotion and tenure process, is probably the most important thing that you can do. Part of that is what you do. Part of it really comes from regular meetings with your division director, your chairman. If your first meeting to discuss this is to prepare to go up to associate professor, several people have missed the boat. These need to be regular meetings. The more important that they're earlier rather than later in your career, because you need to know, is what you're doing valued? Because I don't care what we as faculty council say. If Dr. Stanio, Dr. Whitley, and your promotion committee, your division chief don't think what you're doing is important, we'll never see your packet. So you need to know that what you're doing is important for the people who are directly evaluating you before we're even involved. Criteria, Michelle covered these, so I'm not going to go over that again. The bottom line, but we'll talk about it a little bit later. And this is the approximate calendar. Right now, we are in what we like to call the busy season. So 3 days ago, I was emailed the link with 98 packets, I believe. I'm responsible for 13 myself, 6 as a primary reviewer, 5 as a secondary reviewer, and I'm supposed to read them all. These meetings occur, so what happens is each faculty council member is primary reviewer and generates a review, and a secondary reviewer generates a review on about 12 or 13. These are discussed over 2 days, and the meetings last anywhere from, we block 5 hours a meeting, so 10 hours. I've seen it go 13, 8 or 9 is probably the least. So the things Michelle talked about, brevity, very important. for anyone who's ever written a grant, if I learned when I wrote grants that if it's not bolded or underlined, assume nobody's going to read it. And really, it's the same thing for your packets. If you put in there, your entire PowerPoint presentation for the one lecture you gave, it ain't helping. And it's either killing trees or killing electrons, but it's not helping. Brief, concise, exact, and just so keep in mind that there's 80 some odd other packets or 90 some odd other packets vying for our attention, so that's the main thing. Who can help you? The people who can help you are the people that have been discussed, but everybody can help you. And one of the most underutilized resources are faculty council members, in my opinion. So Ray Watts and Erica Liebelt are on faculty council. PEDS has 2 people. No other department has 2, and most departments have none. So you guys are very fortunate. But you can call me. You can call anyone. And I get a lot of calls during the year, and I wish I got more calls. I get calls from chairmen asking me about faculty members. I get calls from faculty members asking me about things. And I'm always happy to take those calls. I'm happy to look at your CV. I'm happy to talk to people. All of us on faculty council really view it as a part of our job is to talk to people. Promotion from assistant to associate in the tenure track and the non-tenure track. The same rules apply. It just depends on how many criteria. The most important thing is the portfolio. Everything else to be portfolio in your letters. Everything else, quite frankly, is cookie cutter. You don't really have a lot of options in your CV. We developed this whole thing with the portfolio system to the way the portfolio system should be viewed is it's a way to annotate your CV. Especially for the clinicians in the room, there is no place on your CV to talk about your clinical activities. And you have to. This is very true for people in surgery. We'll get these packets and CVs about people in the Department of Surgery, and we'll be extremely underwhelmed. There'll be one sentence, there are hand surgeons, something, and we've sent these back and said, your big thing is clinical service, and all we've seen is one sentence. We don't know how many cases you do. We don't know what your level of expertise is, other than some letters saying that you're competent. So the portfolio for clinicians is the place where you talk about your clinical work, why you're good at it, what you do, in some kind of detail. Accolades. That's terrific, but just plain old clinical productivity absolutely counts, because that's what a lot of us do as part of our job, and that's clinical service. There are many other service things people do. There are many other things people do. And another important point is if you, for example, are in education and you are on the education committee for pediatrics, so you can list that as a service activity and you can list that as a teaching activity. You're allowed to double dip, because it really serves 2 functions, and they're not exclusive. So remember, you're allowed to list things because they really touch 2 bases. The letters, it says 4 to 5. It's 3 is the realistic number. Real quickly about the letters, I mentioned it earlier. Be careful when you choose when your letters are chosen. Now, you submit names and you do not solicit the letters. You would be foolish not to contact the person who you're considering unless you know them really well. You'd be foolish not to contact them. When I was going up for professor, I had a colleague of mine, knew him really well, very, very famous geneticist, knew him really well, worked, we did a lot, interacted a lot at national level stuff. Every meeting we played golf together. I mean, he's my buddy. Said to him, I'm going to put your name down on my list for going up to professor. So he said, are you in the tenure track? Yes, I'm in the tenure track. What do you do? Are you doing what kind of research? I'm not doing any research anymore. I'm just doing the education stuff and the clinical stuff. He goes, well, you wouldn't get. I would never promote you. I could never support that kind of promotion. I'm like, dude. It was the best thing he ever did for me, though. So, right away, off the list. And that was very valuable. I really wouldn't want to see a letter in my packet that says, yeah, he's doing a good job, but in my institution, he's not going to be promoted doing what he's doing. So understand that if you are in the tenure track and you're not highly funded R01 investigator, which is very kosher, it's very okay, but if you're asking somebody at Harvard or at Stanford or at Baylor, their criteria tend to be very different for tenure track faculty. So just be aware of these things when you're choosing letters. And the other thing is, remember who you're choosing. You can't choose your mentor. You can, but you need 3 letters besides that. If your mentor says bad things about you, you have more issues than tenure or promotion. You need letters from people who either know you or know your work. And that's what the point I was going to make is, you don't need people who know you. You need people who know your work. So assuming you're publishing, assuming you're a good, busy clinician, people will know what you're doing. So it doesn't have to be somebody who's familiar with you and knows your wife and your kids' names. It has to be somebody who knows your work and can judge your work. And sometimes that's even better if they could judge your work very objectively just from a CV and a description. So don't be worried that, I don't know enough people. You don't have to know enough people. Your work should speak for itself. I went backwards. And obviously we said limit the fluff. One of the mistakes, so we had a packet of a really good researcher in the non-tenure track. A lot of researchers in the non-tenure track, that's all they do is research. They don't teach. This person in the tenure track. So he's a researcher in the tenure track. Phenomenal research portfolio. Grants, everything. 0 teaching, 0 service. What he put in service, though, was he was a speaker at Berry Middle School Science Day. Now, I'm all about that. I think that's great to do community-related stuff. But when you put something like that in, it's basically screaming, I have done nothing in this category. So don't do that. I mean, it's nice to do that. You could put a one-sentence thing, I'm active in the community, I'm active in teaching school. But that, be aware that this will be interpreted probably appropriately if you put in that kind of silly stuff. And again, I'll tell you that your department, there's a really nice editing process where we wouldn't see that. Okay, associate to full professor. The difference is, from assistant to associate to full, is this notion of national reputation. Again, you may be somebody who's never left the Southeast, but if your work should be known by people in Canada, Canada's still international, Europe, a paper you wrote, or there's some recognition of what you do that goes beyond a regional recognition. So it doesn't, don't be intimidated by the fact you haven't spoken at, a Paris conference or something like that. It just has to be something where your work is known, or people who are outside would know you. And again, limit the fluff. Always limit the fluff. Tenure and promotion in the tenure track should be identical, but perfectly honestly, they're not. So promotion in the tenure track, 2 excellence, and we'll talk real briefly about what excellence is. Tenure, 2 excellence. But the thing with tenure is, like I said, we are betting on you when we award tenure. We are betting the university's money that you will continue to do well. And that, we quite honestly, is a higher bar for us than simply promotion. So that's why we often, and this is, there's no criteria or guideline that says this is allowable, but it's very common practice. If you're in the tenure track and you're asking for tenure and promotion, you're not quite there, but you're doing a good job, we will award promotion and not award tenure, saying that you're on track, but you're not there yet. And we'll send a note saying this is what we expect if you want to get tenure. And usually it means more sustained grant funding, or more publications, or more something. Okay, so what is excellence? Michelle mentioned this, but excellence, to think about it, excellence is cognitive input. You're not on a committee. Being on a committee is important. You need to be on a committee. But you need to have a leadership role on a committee. Or you need to be developing guidelines that the committee is going to implement. So intellectual input, not just activity. That is what we're looking for. Clinical service. Your somebody who is developing something. Like Michelle said, you have a niche. You're somebody who people can look at and say, oh, you're really good at that. There's only so many things, there's only so many niches around, so it's not that everybody's going to have their own little thing, but you're recognized as, being really, really good at what you do when it comes to just pure clinical activity. Okay, just scratch it. Citizenship. One of the things that is undervalued or often, but isn't by us, is being a good guy or good gal. So the fact you're willing to help people out, you're somebody who, it's really busy, but you're not admitting, but you're willing to stay an extra hour to admit a couple patients because they're overwhelmed, or you're more than happy in your lab to loan out some equipment or help somebody else's experiment. That counts, and just making sure it gets documented, but that counts. And just doing things that, when there's a committee coming up for like the waste disposal committee, and you volunteer for that counts, because you're being a good citizen. Community outreach activities absolutely count. Probably not what you want to hang your hat when you're looking at excellence, but those are all important things. Now, anything I say, by the way, is what we look at. It always comes down to your division chief and your department chair to be the ultimate judge on, is this activity valuable? So if you're about to sign on to be on the park and rec board for your town, and that's going to take a day of your time, you might want to run that by your division chief before you're willing to commit a huge amount of time to a community service like that. Teaching, again, develop curricula, courses, not just I attend on the wards, I give a couple of lectures. You have to be really working on something to develop a lecture series or a program, something like that. Mentoring, and like Michelle said, keep names, keep dates, you have to have a documentation. Anything where somebody sends you a thank you, you did a great job, I really appreciated it, save that. Research, grants. Now, I don't know how many people here, was anybody here, does anybody here funded investigator type person? Or can I do, okay, well, enough, okay. You may or may not be aware, but it's a tough time for you. We are aware of that. We are aware that it's really hard to get money. In the old days, there were clear criteria. You had to get a certain number of grants. The renewed R01 was almost a given. Now we're not quite as stringent, but still money counts. It doesn't have to be NIH money, but money counts. And then manuscripts, there is no number. I put numbers up there. There's no number for what you need, but you need to be a last author. Back to the whole mentor thing. If you're working with your mentor, that's great. But if your mentor is on every paper you've ever written, not as great. If your mentor is last author, really not as great. You need to show independence. Independence is a major thing that we look for. So what you can do now, you should always be in contact with your division chief, your department chair, your mentor, to make sure you're doing, your activities are in line with what you want out of it. That these are things that promotion will be you're working your way towards promotion. If you are really busy doing something and your division chief looks at you and says, that's great, but I don't know why you're doing it, you got to stop. Unless you really, really love it, and then you got to work extra hard. You have to be aware of how your activities line up with your goals. So with that, I'm going to stop. If anybody has any questions, or proceed to Dr. Staniel.
Well, thank you. I'm very lucky that we had the presentation this morning from Michelle and Nat, because they've given really very detailed information about the process. One thing I would like to do is to recognize the fact that this is not just Nat telling us, but we have received word from others that the Department of Pediatric packages have been very well prepared, very well received. I think that Claire here does a terrific job in collecting all the information, summarizing, calling you, making sure that all the details are addressed so that the package gets stronger. That is a lot of work. It takes basically the entire year from start to finish. I would also like to tell you that although it is a challenging time to put your package and go through promotion, but when the quality of the package is such as we have been able to generate, we don't face many problems. In fact, in my kind of long career promoting people, I've had only 2 visits to the faculty council to argue in favor of somebody. And only once was a promotion to tenure delayed when we had asked that it be simultaneous with the promotion to associate professor, was delayed to the next year. So it's really incredible record, but it takes an effort from everybody, and it really starts with you. The faculty form that you asked to complete, and everybody laughed a little bit saying that it's very difficult and hard, tedious, whatever. That document, really, it's also difficult for me to read it all and try to extract information and try to get the substance of what you're doing. It's the start process. That's where it all begins. We make a decision soon as to who should be moving for promotion. By September, we will know, and there will be a discussion with the division directors to say this person is coming up and we should begin to prepare. So that, I think it's very important. Say things there that if you think are valuable, we can begin to judge early and we can make corrections if necessary, okay? When we ask for the curriculum vitae, and this has been emphasized now by Michelle and Nat, make sure that the format of the curriculum is the correct one. We still get curriculum vitae that come and they're in the old format, and then we have to redo the whole thing. So follow that. I was surprised a little bit that not very many hands went up when we're talking about mentors, okay? I think, in my judgment, mentors are absolutely essential. The mentor is an individual who really will have a lot to say about your success. They may be friendly, but they also need to be very tough. They may to criticize, they need to be prepared to criticize you on presentations, posters, articles, grant proposals that you're writing, whatever you're doing. They need to be very honest and say, I don't like this, this is what you need to do. And they need to put timelines in front of you to make sure that you get those things done in the right time. I think that we've heard already several times that these are very difficult times, and this is probably unprecedented. Every area that I look at is going down in terms of the opportunities to get funds, whether it's medical school, which means state support. We've had over 20% cut in 5 years. So we're now being funded at the level of 1999. That gives you an idea of the magnitude of the problem. The NIH, everybody who's competing for NIH funding knows how difficult that is. We've had very successful individuals, very good proposals going to the NIH, and the ranking is such that they will not get funded. And in a regular, normal time, they would have clearly been funded. And if they go back and they make all the improvements that were requested, again, they get ranked in the same line, and again, for the second time, cannot be funded. If it's a K award, that means that you already burned your boat. You have to go back and come up with a different idea and then start all over again. So that's a very, very challenging. Whether it's patient care, as I said, research, medical, school, everywhere you want to look at. Where does the support come from? And I summarize this, it's been said already. At the department level, you've got to have and identify your mentor or mentors if necessary. talk to the department leadership. There's online material that's been emphasized, and there are career development champions. I want to emphasize something that I don't think was said necessarily, that our committee is not just a promotion committee. From the outset, from the very beginning, I designated that committee as career development and promotion, because we do have people that can help you look at what you're doing and try to direct you in the right way, encourage you to do. I mean, Michelle, Annalise here have done terrific. I mean, Michelle still stands as the best package ever for promotion. And we've encouraged her to talk to many to suggest exactly how to put it together. So that's critical, okay, the people that you're going to have there. At the school level, there's online material. You've already been pointed out to that. There's now a faculty development office. Dr. Rogers is the lead of that, right, hired recently. This is what Kathy Nelson used to be in charge of. Now this is getting a new direction. There will be some resources there again for centralized. Think that there are interdisciplinary centers, like the CCTS is one good example, one of among many, where there are people that you need to network with, and they're going to be offering, okay, opportunities from funding in some cases to training, writing, discussing, career development as well, and then there are grants on campus, the K grants, the T grants, where trainees and mentors get together. And these are in different departments, and you need to find how to access that network. I think it's important. And then within departments, I think we try to collaborate as much as possible. I was going to give you one example. I think that this is tomorrow. This is a CTS. I don't know if you had seen this. These things are published. They're in the email. We try to throw away all the stuff that we're not interested in. But sometimes they're good ads. If I see something, I usually give to Claire to distribute among faculty. So pay attention. These are opportunities for people to get together and talk about the same thing that we're doing right now. There's a time limit. With tenure on the 9th year, you're either in and out. And we have to tell you, if we don't have the strong accomplishments, that's going to be the terminal year for the award of tenure. And that's a very negative thing to do. So it's rather go the other way around. Sometimes start in the non-tenure, but you become successful in the things you're doing, then we can switch you to the tenure track, and then you have 9 years to achieve it. That is far, far more palatable to people that are going to be in transition. We also have to be sensitive to the fact that the department now is a majority female faculty. And you all know that we have issues of family, kids. Many people cannot work full time and carry the responsibility at home at the same time. So for those faculty, it's better to be in a non-pressure cooker the first few years, and if they decide to pursue a career that will lead to tenure, do it then, and then we can switch. Yes, you have to kind of terminate and fire, right? That's what Nat said. But we're smart. Our advertising, if you look at our ads, it always says all levels. So we're recruiting for assistant, associate professor, tenure or non-tenure. So the ads already are defining that you could be switching without having to terminate you and then rehire you, okay? So those are the little details. And then finally, what does it mean that the university is making a commitment to you? I've been at this for a long time. I really don't have any idea who is tenured or not tenured in the department, okay? We have people in the promotion career development committee, some are tenured, some are not tenured, okay? And when the university or the handout, the handbook says that we're making a commitment, a financial commitment, a couple of things. First, there's a cap on the financial commitment. And probably it would mean that even if you get the salary, the UAB salary, you're going to be a significant cut because the cap for that rank across the university is much lower than what you're getting now. Second, the university can define your situation in a division, a service, or a department that is at risk, okay? Some crises, right? And once they find that, they have the liberty to rearrange everything. And so, really, it doesn't amount to a lot. But it is a prestigious thing for some people, and you're entitled to do it. So, if you're going to fight for it, do it. But again, make sure that you're following the advice and the recommendations we're giving you, and try to make absolutely sure that you really can demonstrate excellence in 2 areas. So I'm going to stop here because I think it's more important to answer questions than to continue to rehash something that has already been said. Thank you.